Hello, how are you all? Hope you all are fine and preparing well for AMC Part 1 examination. This is Dr. Zehra and we are solving some recalls from the Gynae section. Hope this video will be helpful for you. So let's start. A 55-year-old woman present to your GP practice with a complaint of dyspareunia, dysuria and vaginal itch. She has been menopause since the age of 50 years. She relates that sexual intercourse has becoming progressively painful for the past 6 months. She described the pain as a burning. The vaginal itching and dysuria has developed in the past few weeks. Her past medical history is unremarkable and she is currently on no medication except for the supplemental vitamins. She denies any hot flushes. On examination. Atrophy of the labia minora is evident, but labia majora and other parts of the vulva are normal. Vaginal examination reveals a rather stenotic vagina with pale and atrophic vulva, but no vaginal or cervical inflammation or discharge. Which one of the following would be the most appropriate first line treatment for her? A. Estrogen cream. B. Topical antifungal agent. C. Conization. D. Hydrocortisone cream. E. Topical antibiotics. So first of all, topical antifungal agent is completely the wrong option here. Why this is the wrong option? Because they have clearly mentioned that there is no vaginal or cervical inflammation or discharge. They have noted on examination. That's mean there is no infection. Even the patient is complaining of dyspareunia, dysuria and vaginal itch, but they have noted no vaginal or cervical inflammation or discharge. That's mean there is no need of topical antifungal agent. When we have to mark the topical antifungal agent, when they are mentioning the vaginal discharge noted, and it is along with the vaginal itch and creamy yogurt vaginal discharge, creamy yogurt like appearance of the vaginal discharge. So this sentence is indicated that patient is having a candidal infection or fungal infection. Then in that situation antifungal agent is needed, but here they have clearly mentioned that there is no vaginal discharge is noted on vaginal examination. So they have exclude the infection, the candidal infection here, the fungal infection here they have excluded by mentioning this statement. So um, we can easily rule out that there is no fungal infection. Plus, there is no bacterial infection as well. They have clearly mentioned that there is no vaginal discharge or cervical or vaginal inflammation noted. So, no need of topical antibiotic because there is no bacterial, no fungal infection. The next important thing is conization. Why conization? Conization, no need of conization here because when the conization is needed, if they have mentioned that they have taken the cervical cytology and the cervical cytology or pap smear report revealed cervical intraepithelial neoplasia. So, if cervical intraepithelial neoplasia means precancerous condition has been noted in the cervical cytology test, then we have to go for the conization. But here there is no such a statement mentioned in the question. So we can easily exclude the topical antifungal agent, conization, topical antibiotic. Now the remaining is hydrocortisone cream and the estrogen cream. So when we have to mark the hydrocortisone cream, when the patient is having, yes, the age is 55-year-old and there are the chances that patient could have the lichen sclerosis. So in lichen sclerosis, if If the condition they have mentioned that on examination there is a whitish appearance of the labia majora, or there is a whitish spots they have noted on the labia majora, then this means that whitish spots on the labia majora, if they are mentioning that on examination there are the whitish spots they have revealed, so that's mean the patient is having a lichen sclerosis. So, if they want you to mark the hydrocortisone cream, then they surely mention you in the examination about the whitish appearance on examination of labia majora or even the labia minora, but they will clearly mention you that the whitish appearance on the examination of the vulva of labia majora or labia minora, but they haven't mentioned anything. That's mean patient is not having a lichen sclerosis, or they can clearly mention you that patient is having a lichen sclerosis or suspicious of the lichen sclerosis. Then in that condition we have to mark the hydrocortisone cream, because the treatment for the lichen sclerosis or even with the lichen planus, the treatment is corticosteroid. But here they haven't mentioned any such a statement, and they have clearly mentioned that patient is 55-year-old. Patient is having a dyspareunia, means difficulty in intercourse, dysuria, difficulty in passing urine, and vaginal itch. And moreover, the statement they have given that she has been menopausal since the age of 50 years, and there is a atrophic walls. This mean patient is having a estrogen deficiency because of the menopause. In the menopause we all know that normal cycles are not there, so there are deficiency of the estrogen, and because of the deficiency of the estrogen, some patient having a complaint of this dyspareunia, dysuria, and vaginal itch along with the atrophy of the vulva. This clearly indicating that patient is having this symptom because of the menopause. And what's happening in the menopause in this age group, the estrogen is deficient. So whenever the estrogen is deficient, there is atrophy of the vulva, and these symptoms could happen. So the correct answer is estrogen cream. Topical estrogen cream we have to give to this patient to reduce this estrogen deficiency symptoms because of the menopausal age group. So correct answer is estrogen cream here. So the most appropriate first line treatment for her is estrogen cream. Correct answer is A, estrogen cream. I have clearly ruled out all the other options when we have to choose the other options. So I hope this video clear your concept. Thank you very much.